Um, Welcome to this event between Rock Recovery and Equip. We're excited to all be here and talk more about getting eating disorder care as a BIPOC individual. As some of you may be aware, it is Eating Disorder Awareness Week, so this is really important for us to talk about and discuss kind of like why we're here and the power of community and kind of all working together and just feeling more supported by everyone in all different backgrounds. So I know it's nice seeing all the different faces here and us kind of working together to, make this just a mission, I think, for all of us. So I'm gonna hop this over to Tammy to introduce herself.
Hi, everyone. So my name is Tammy, and I am the clinical partnership liaison with Equip. Being a BIPOC individual, sometimes it can be a real challenge when it comes to finding eating disorder care, whether it is the background that we come from that does not acknowledge eating disorders, finding help is sometimes frowned upon, or even finding a provider that really understands our background can sometimes be challenging. And because of that, it can be really isolating, but we're not alone. This is where Equip can come in to be a great resource for you. So we are a 100% virtual evidence-based eating disorder treatment program that offers a higher level of care. We meet you where you are. We are available in all 50 states, including Washington, D.C. Our patient population is of all gender, of all ages, and all backgrounds, so all walks of life. We accept most major insurance companies, and best of all, we don't have a wait list. Every one of our patient gets a 5 to 6 person multidisciplinary care team. So they will have a medical provider, a therapist, dietitian, peer mentor, family or support mentor, as well as a psychiatrist on the team if medication management is needed. And we also have a language line of over 240 plus languages for individuals and families that would like that service. And lastly, we have many resources that we are able to provide everyone to really, really empower them through their journey in addition with their supportive care team. So please feel free to reach out if you have any questions.
Thank you, Tammy. Izzy, do you mind introducing yourself and telling us more about Rock Recovery?
Yes. Hi, everyone. I'm Izzy Vogt. I'm the Outreach and Admin Coordinator at Rock Recovery. We are a mental health nonprofit in Arlington, Virginia, and our mission is to make eating disorder therapy more accessible and affordable for everyone. And we do this by trying to remove the barriers that keep people from being able to access treatment, such as finances, accessibility, and we try to connect them with quality care and community. And we do this by offering a variety of outpatient eating disorder therapy services and nationwide faith-based support groups, all at sliding scale rates to try to meet people where they financially are at. We also host a number of community events and try to partner with local organizations, schools, churches, other nonprofits, etc., to raise awareness about mental health and remove stigma from mental health in the community.
Okay, so now we're just going to talk real quickly about just some statistics that are just helpful for all of us to know. 20 to 26% of those affected by eating disorders are BIPOC individuals. 50% of BIPOC individuals are half as likely to be are more likely than, oops, sorry, my screen. Excuse me, their white peers to exhibit behaviors of bulimia. So these are just some statistics that we thought would be helpful for us to share. And next we will hop over to our panelists to introduce themselves.
Are we going in this order?
Yeah, why don't we go in order? Tassi, do you want to go first?
Of course. Well, first of all, good evening, everyone, and thank you, Rock Recovery and Equip, for just hosting such a wonderful event. It's great to talk about these things, especially because it's not very much talked about in the BIPOC community. So thank you. But my name is Natasha James. I go by Tassie for short. I am a therapist with Rock Recovery. I've been in the ED field for about a little bit over 2 years now. So considered really new into the field. However, since being within this, working with eating disorders, it's been a very learning and unlearning experience. And so I feel like I found my niche, and this is something that I have a passion about, especially because it holds so true to what I've gone through being a woman of color and in a fat body. So yeah, I love working with this community of people, and I am excited to talk more about like how to do more outreach for BIPOC communities.
On the slide, so I'll go ahead and go. I'm Zaina, and I am a registered dietitian and a community outreach liaison at ERC Pathlight, which is another treatment center that has nationwide in Rock Recovery. As a registered dietitian, I think we're good now. I have worked as a registered dietitian for about 15 years now, and have spent the majority of my career treating individuals with eating disorders or disordered eating patterns. And I'm very passionate about helping break stigma and also reach people where they are. So anyone from all walks of life, all backgrounds, to be treated fairly and be provided not only the care they need, but the best care that they can possibly get to help them. And I find it so important, especially as a dietitian, to be able to be culturally aware and make sure that when we are talking to people from all different backgrounds and we're making recommendations, we're honoring their culture and we're honoring what they have grown up doing, and helping bridge that gap in treatment. So happy to be here, happy to answer any questions that come my way, and I'll hand it over to the next person.
That was me. Hello, everyone. My name is Michaela. My patients like to call me Mac, so it's Michaela Mac, whatever you're feeling tonight. I use she, her pronouns, and I'm a lead peer mentor with Equip Health. Peer mentorship is pretty incredible. I call it like the magic sauce of eating disorder care, because we get to share our lived experience and talk about recovery, especially ongoing as we live in our recovered bodies, right? What brought me to Equip was actually 2 years ago. I found a job posting. I was like, let me do this, right? And then I really found my calling within the eating disorder community, because unlike others, it took me 6 years to be diagnosed. I was on public assistance. It was actually my dentist to diagnose me because of my tooth decay from bulimia nervosa and binge eating disorder. From the story, though, what I've taken is a lot of community healing, a lot of aspects, but I've also found a lot of barriers, right? So I do a lot of public speaking as it relates to being in the Black body, as it relates to being queer, and facing barriers of being in a single parent household and food insecurity and all pieces of that. I'm really grateful and glad we're having this conversation tonight. I want to shout out Equip, of course, and also Rock Recovery. Just appreciate you all. I'm gonna hand it off to my fabulous coworker, Grace.
Wow, that's a lot to follow up on. I'm Grace. I use she, her pronouns. I am a psychiatric nurse practitioner with Equip. I am also, hopping off of that, I came to Equip and took on this role as a psychiatric nurse practitioner not too long ago. It's still my first year of being a nurse practitioner, so I'm new. However, sort of my entry into the eating disorder world was through my lived experience being a patient myself and sort of going through and navigating how to get care, being an Asian American, being in a Korean household that did not have the language or the understanding of what an eating disorder was, or even what mental health was, navigating sort of how to get care when I had sort of government assisted, insurance that does not really have all the tools necessary to get good care out there. And I take that experience and really bring it to the other side now as a provider myself, I think I take a lot of my own experiences, what I've known to have been harmful in getting treatment, what's been helpful, and trying to translate that in the work that I do with families, especially families of color here at Equip. Thank you so much for inviting me, for giving us a voice on a platform like this. I think it means a lot to be able to see folks who look like you, talk like you, think like you, to be able to have say in this space. So happy to be here.
Sorry, I was muted. I'm Nushin Kiankui. I am moderating this, but I'm also an eating disorder therapist. I have my own practice here in the DMV as an eating disorder specialist and also specializing in a lot of trauma work. I've been in the field for about 15 years now. And I'm also a certified eating disorder specialist as well. So, and I have the supervisory credential. So it's nice to be able to support others that are looking to dig more into this field. I myself am Iranian. I have been here for most of my life, but my parents being first generation here, just from a general mental health space, there were a lot of just barriers that kind of got in the way of getting support, and just like them not even knowing what a therapist was. And I was like, I want to go to school for this, and they're like, what is that? So that's where I've had my struggles. But working in the eating disorder field for about 15 years, I've come across all sorts of people, and it's just been a wonderful population to work with. So I'm so happy to be here, and I'm thankful for Rock Recovery and Equip asking me to moderate this panel. And thank you for everyone for being here too. I know I've done panels, and it's very, you're very vulnerable, but it's also, I think, very empowering and rewarding to be able to share our stories. So what we're going to do now is we're going to go straight to our panel questions, and we will have a question answer after. So let me just hop over to my, okay. So what I would like to do is ask everybody, the four panelists we have here, more about your background in treating BIPOC individuals, if you haven't already shared that with your introduction, with eating disorders, and any main takeaways that you have from treating those BIPOC individuals. And anybody can start.
I'm happy to jump off and start. So I started in community health, actually. I was briefly a dietitian at an inner city hospital, actually in DC. So most of the beginning part of my career, I spent working with individuals from all different backgrounds, typically lower income. And I found it so incredibly helpful to be able to connect. And a lot of the times when seeking a medical provider, it's hard when you don't see yourself. And as an Arab American, first generation born here, you didn't feel represented, but when you saw someone, even if you maybe weren't the same race, if you were a minority, you felt a connection. And so I felt like being able to connect and help made such a huge difference. And since I've moved out of community health, but continued to specialize in eating disorders, and find that because eating disorders in BIPOC individuals is often overlooked, or maybe not what is stereotypically what you see in an eating disorder, think of an eating disorder, that being able to connect and be culturally aware is so important and so helpful. And that's where I've put a lot of my focus since. I hope I answered. If I didn't answer that enough, then by all means, ask me more questions. I'm happy to talk more.
Thank you, Zaina. And for those of you if you want to ask questions, you can just check out the chat as to how to ask them, whether you want to be anonymous or not, or you can raise your hand. Thank you, Zaina. Does anyone else have anything to add?
Language. Okay. I think thinking of the facility, I work with Equip as a lead peer mentor. I also do a lot of volunteering with other eating disorders outside of Equip. And one of the biggest things I see, and they do such a fabulous job of this, and this is something as a society we haven't worked on, is being used to the different family systems. You know, my grandmother was the one who helped me throughout my whole entire life. She was the one to figure it out for me, to call me, to do everything. And every single time they'd call and they'd be like, where's the mom? Where's the dad? We don't want to talk to you. We want to talk to, no. Where's the carers? Right? Where's the supports? How do we show up for your household? What do you need? Right? Having open-ended questions, really being genuine and generous with your language and intentional. It's so important. I think we lose that aspect as it comes to the jargon in healthcare, as it comes to all the medical pieces. We have to learn to get back to the basics as it comes to our language. Belongingness in our culture is something we're still learning, especially for BIPOC individuals. So at the bare minimum, we can start with our language. That's where my brain goes to.
Anyone else have anything else to add around just your background in treating BIPOC individuals, or just any takeaways you have from treating them?
Yeah, a little bit about my background. I started my career almost 10 years ago now, working with a lot of underrepresented communities and low such socioeconomic individuals as well. And a lot of what I did starting out was, how do we get access? How do we get affordable access? How do we get quality access? So a lot of the work I did was working with families, working with parents on how to, what questions to ask, what resources can I look at, sitting with them, how do I apply for these things so that I can get quality care? Because that was one thing I realized early on, is that it's not accessible for everybody. It's kind of seen as a privilege to have appropriate care. You know what I'm saying? So a lot of what I did early on, and even till now, working specifically with eating disorder clients, is how do we advocate for ourselves in these spaces where it doesn't come easy to? How do we know how to look for things? What questions can we ask? And so that's what a lot of what I do a lot with my BIPOC clients is advocating for themselves, for sure.
I echo what everybody has shared, and I think in my experience, some of my main takeaways working with the BIPOC sort of community is that a lot of folks present to care, I think, much later and deeper into their eating disorder because we aren't screened appropriately or soon enough. And so often I think families come to us understandably so panicked and needing, I think, reassurance, needing guidance, needing support from oftentimes folks who are seen as the other, right? I think culturally, even just speaking from my Korean culture, there's a fear of reaching out for help, fear of the medical system in and of itself. And so when we're in this crisis mode, I think I see a lot of families equally kind of come to care with us here at Equip and feel almost paralyzed by how ill and sick their child is. And I think something that I really try to do and remind myself is, this is because sort of our community doesn't have the support that we need where we talk about these things. Our PCPs don't screen us of color the same way they screen other folks. And it's a reality that I think a lot of our community doesn't talk about. And so I think that's sort of what I realized in the past when working with our families, is really normalizing, this fear is part of treatment, is why we need to improve treatment, and that we're here to support you, and we try to be respectful of that and meet them where they are. So
Thank you, Grace. Thank you, everybody. Did anybody else have anything to add on that question? Okay, so this next question is for anybody. What do you think the primary challenges and barriers to care are for BIPOC individuals seeking eating disorder treatment? And what can clinicians do to bridge these gaps and barriers?
I can hop off. The biggest one that comes to mind for me is the commonly used metrics in our medical care system to identify what health looks like, what healthy is, what's unhealthy, and the fact that they don't apply to all bodies. And when we try to fit people into these molds, so to speak, and they don't, we overlook or we inadvertently cause harm when we try to make them fit when they're not going to. And so that's my biggest one. And many of you may be familiar with BMI or body mass index. You may even be familiar with certain lab values that are used, and not understanding that culturally, not culturally, but based on race, our bodies are shaped differently. All of our bodies are different. It doesn't matter what your background is. And so when we try to put it into one thing, I think that a lot of times it results in either delayed care or inappropriate care or harm. The other one that comes to mind for me when I think about that is how we approach conversations, whether language is a barrier or not. We have to understand that we're not all seen in the healthcare system the same way. So if we're not really sitting down and having open conversations or asking, probing, it feels like a wrong word, but it's the word that came into my mind, leading questions, where you aren't looking for a yes, no answer or a quick thing, you're actually asking. You want to know what's really happening, what someone's really feeling. Then so many things get missed because you're ashamed, you don't feel like you're allowed to talk about it, you've been told you're not supposed to talk about it, and so many other things. I think those are the two really big ones that come to my mind that I see that have what I feel like is a really big impact on not only access, but the type of care, and then misdiagnosing or delayed diagnosis.
Can also definitely add to that. I absolutely echo what Zano shared. And I think for me, one of the primary challenges is the fact that even within the knowledge of eating disorders, we have a very, I guess, stereotypical image of what an eating disorder looks like. And we know that in the BIPOC community, that is really not how eating disorders often present. Binge eating disorder, OSFED, RFID, those are the diagnoses that throughout research we've seen often impacts our folks of color more. And we don't necessarily think of that immediately when we meet someone in a hospital room or in our space where we first screen our patients. So I think one of the primary challenges is having metrics be applied to anyone of any shape, color, size, background, and having that knowledge be taught, I think, in our medical system is just something that isn't being done. One of the other barriers that I really think that continue to exist is that when we seek care here, and I think in America, a lot of it is through our, again, private insurance that we often have privilege to either have, or we're stuck with sort of the state-based insurance care. And I think the way that a lot of BIPOC folks get care is they ask their communities first. They ask their churches first. They're asked their, village first before going out to a hospital or going out to calling their insurance companies. And I think we don't have a lot of this knowledge that's passed down into our communities where care is actually first sought out. And I think that's why so much of our folks meet us much later, is because we don't meet them where they're struggling. We wait for them to come to us, meaning sort of by the biomedical sphere. And I think that's really something that I feel strongly that we should be going out to places of worship, places that people congregate, where BIPOC folks meet, talk, seek care and community together. something that I think clinicians can do, and I strive for, is to be on lists that folks actually utilize in the communities that they're in. So if there's directories for folks of color, at least for me, for the AAPI community, add myself to that list. Encourage not only care with me, who I see through Equip, but if there are free support groups led by folks of color in the community, to encourage those as well. And really make it clear that there are more support systems out there, that just because we're invisible, at least until you get to the hospital or the care system, that we're out there, and sort of making that accessible to our patients, I think, is something that we can do to bridge the gap.
Thank you, Grace. Does anybody else have any other thoughts on that question?
I definitely want to piggyback off of what Grace said. I think you were just very spot on just talking about accessibility to care. Some people just don't know. Some people don't have even, going back to the language, don't even know or understand like maybe some of their eating habits, how it could be harmful. Because again, it's not openly discussed all the time. And so that outreach piece is very, very important to getting just the basic education about eating disorders. Because one thing for me, I did not know much about eating disorders. I had, again, like a probably like a blanket view, a general view of what it was. And I was like, oh yeah, it's definitely a white person's problem. That's definitely has come up before. But then as I am learning and unlearning, like I said, it's like, wow, I resonate with this because I didn't realize that it's embedded in my culture, it's embedded in my household. And it took me being in this field to learn. So imagine with those who don't have that access to work in the mental health field or be places where it's talked about openly. Imagine where they are. So I definitely want to, piggyback off of that outreach is important. Community outreach is important. Being in those communities, in those spaces that, the churches, the community centers, to these HBCUs, to colleges, like talking about it often and openly and leaving that space that's safe for them to come and say like, okay, I want to learn more. You've piqued my curiosity.
Thank you, Tassie. So let's move on to the next question. What advice would you give to BIPOC individuals seeking eating disorder treatment for the first time?
I can start with this with some lived experience. One thing I always say is I wish that like in 2024, with how much, we've adapted virtually for support groups and everything else, I wish we had that 15 years ago. I wish I had it 10 years ago. Something I continually say. And now that we're in 2024, I think the best advice I can give to anyone out there is go to the spaces of your communities. There are free support groups for BIPOC individuals, for queer individuals, for gender nonconforming. Go to those spaces, have those conversations. Psychological safety is built when you're in these spaces where you share the identity and you can have these open and direct conversations. And we have to have this conversation of that eating disorder care wasn't built for our bodies, right? When eating disorder care came, it was during a time where in our country, Black people didn't even have full access to care, right? BIPOC individuals were still stigmatized outside of just healthcare, just socially, right? And now we're like trying to play the game of catch up to be like, oh, but it's working, it's for everyone. All these, the treatment's for everyone. And it is, and we still need to get back to our communities to have this conversation of it's impacting us and how do we break the barriers. One thing I didn't have on my recovery was a BIPOC community to talk about these things with. I had my family, but I didn't have like a community of those who were recovered. I also didn't have anyone that was queer around me. So it took me forever to come out of the closet because not on top of it was I BIPOC. I couldn't be BIPOC with an eating disorder in a fat body and also be gay. That's too much, right? Like that's way too much, right? So we need to know that we're not too much and that we can be fully ourselves. So go out to your communities, have these tough conversations, build that psychological safety for yourself.
I can piggyback on that. I think maybe two pieces of advice would be: first, be confident that you know your body. And even if you aren't sure what your body's telling you, you know when something probably doesn't feel right. And even if you don't feel like you're being heard, I encourage you to keep asking, keep pushing, ask for another opinion, find another source, because one of the things that I find so helpful is empowering people to learn how to trust their body and how to understand what it's trying to tell them. The second piece would be, if you're looking for someone, at least in the field of dietetics, who identifies with you, there is a group, there's actually a nonprofit called Diversified Dietetics, and you can look based on your background and find providers across the US who identify similarly, and you can seek help that way. I think they probably, in the listserv, you can also look by insurance and a ton of other information. And so there are resources out if you can find them, and that's a great one to look at too.
And I'm going to answer this based off the assumption that this is an individual who recognizes, like, okay, there's a problem, and I need to, I feel like I need to seek help for this. I believe Grace may have said it, like those different websites that are geared specifically for BIPOC communities for finding providers. I highly recommend searching for those. There's so many. I wish I could have them on the top of my head to share. And maybe it's something I could share with the staff here to maybe provide for later. But yeah, there are definitely different websites just specifically for BIPOC communities to search for other BIPOC providers, especially if you want to keep that within your own culture and race. And so, yeah, I heavily recommend that. And in terms of if you do have the privilege of having insurance, going through your insurance carrier and searching out, treatment facilities or dietitians or therapists that can provide me services, and that will take your insurance.
We did pop the Diversified Dietetics into the chat for anybody that's interested in that resource. That sounds really cool. Thank you for sharing that, Zaina. We can move on to our next question. How do you incorporate cultural considerations into your treatment approach? And can you provide examples of how you tailor treatment plans to address the cultural backgrounds and experiences of BIPOC clients?
Happy to jump in on this one again. So for me, as a dietitian, so what I focus on is really understanding first, as much as I can, about the family system. Is there someone who cooks at home? Do you eat out? How frequently? Who's responsible for the cooking if that happens? What is it like when you all eat? Is it a sit-down dinner? Is everyone different, doing their own thing? The next piece I ask is a lot of information about food and making sure that I'm not trying to provide recommendations that don't align with how they and their family eat. So being culturally aware of different foods. A lot of the times that has been, at least in outpatient care, which is where I've spent majority of my time, a big barrier to seeking treatment is, what if I go to a facility and they don't have the food that I'm used to eating? And it's perceived as avoidance or restriction or something related to the eating disorder when it's not. And so I make it a point to learn as much as I can and make recommendations that align. A lot of the times, what's considered like ethnic foods don't fit the standard myplate.gov, if you ever have seen that, where a plate's half, right? It doesn't. It's mixed. It's flavor. It's everything all wrapped up into a grape leaf or a dumpling or a bun or X, Y, and Z from every culture. And so being able to translate that and make it easier for families and cultures to eat what they're comfortable with and meet their needs and be in recovery all at the same time.
Yes, I absolutely agree with everything you just said. I actually did a social determinants of health, otherwise known as SDOH training, about a year ago on the similar things that you just said. And what we highlighted was that the My Plate doesn't fit when it comes to like family sharing, family meals, right? So we actually created a bowl situation, a bowl method that we ended up training on. I see Grace, you're smiling because you remember that. But we ended up showing that it doesn't have to be a plate. And why is it only a 2D model? Why don't we have 3D models of what we're showing to our families? That's how most people eat, right? And most people see their food and visualize it and have that relationship with their food. The reason I'm highlighting it, and thank you so much for putting that link in there. If you haven't, as a provider, done your own research on social determinants of health and understood how to implement it into your own care, please go out and get those trainings. Please go out and have those conversations. That's the biggest part of my cultural competence as I show up in this work, is taking in every single piece. So it's broken down by economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. We're thinking about the person as a whole and as a person versus like them just showing up on the doorstep and just coming into our room. So I 10 out of 10 recommend social determinants of health.
Yeah, I 10 out of 10 just echo what Max said. So I am a psychiatric nurse practitioner, and so I sort of sit in this uncomfortable space for a lot of my families where you're seeing a psych provider, and it's often, at least in my Asian culture and most BIPOC cultures, something seen close to a failure somehow inherently. If I am talking to a mental health professional, if I'm seeing a mental health professional, and God forbid, someone is telling me now to take a medication. And I deeply understand that. I absolutely know how raw and vulnerable some of my families come to me, knowing that they are at a point where they have to speak to somebody that they would rather not speak to. And so I think cultural considerations for me starts from the get-go of really laying the foundation of, you are not coming to see me with this power differential of I am a somehow provider and you are a patient, but we're here together to kind of work together to make you feel empowered for your own mental health care. I think it starts from the moment I meet them. The other thing that I also sort of try my best to really incorporate from my first intake is to ask about what aspect of traditional medicine healing or your culture's healing do you abide by, believe in, want to incorporate? What part of that actually has not helped you in your experience with an eating disorder? What your parents believe, what your family believes, do you believe that? And I think I take a lot of time trying to understand, somebody can show up and say and identify as a certain culture, race, background, but that looks very different for every single person. So I really try to assess what their language is around mental health, what their language is around their experiences of an eating disorder. A lot of folks, I think, in the East Asian cultures, we talk about eating disorders often as diets, and we only really think of it as problematic when it starts to result in certain somatic symptoms. And so because there's a lack of language, I try to give them that language. The other sort of thing that I try to tailor in my treatment is really coming at it from sort of the social determinants of health lens, really sort of actively anti-racist work, and being really up to date with the research about what's important culturally, what in our biomedical sphere is inherently racist, and how can I sort of dismantle that and make it so that when people come to me in my sessions, they don't feel judgment, they don't feel like there's going to be an impending medication that's going to be prescribed, but really that it's a discussion and that it's both of us going on this journey together rather than me giving a medication to somebody, if that makes sense. So.
Yeah, and I can just echo with what everybody just said. Especially in those initial stages of meeting with my client, it's a lot of just trying to understand like what part did food place, describe food culture in the home, describe the traditions. What about your body? I know some cultures, some bodies, thinner bodies are more idolized and larger bodies or vice versa. How did that play a part in your role in your family? Just like what did body stigma, weight stigma, all of that, what did that look like in your household growing up until now? So I think it's really important in those early stages to ask those questions. And I am a very curious person. I like to take the extra mile too, to do my own research, to check my own biases, and to make sure that I am well informed on their culture and well versed, so that when things are brought up to me, I can be more sound. I could be very sensitive and very encouraging to them without, offending. So I definitely do my due diligence as well as the provider to make sure that I am very well versed and equipped on their culture and their backgrounds.
Thank you, everyone. Let's move on to the next question. How do you empower BIPOC individuals to advocate for themselves within the treatment process?
My grandma would be so mad at me if I didn't start off on this one. My grandmother, she's the single parent who raised me. She's still with us, love of my life. I'll probably call her after this, by the way. Anyways, she called every single day. She called that Medicaid office every single day that ended with a Y. So if you can't do it, find someone who loves you. Find someone who's going to step up and support you. Because advocating for yourself gets so exhausting. I'm even getting emotional thinking about it for my own patients. This is exhausting work. It's exhausting. It's exhausting to get to care. It's exhausting to get to recovery. It's exhausting. It's worth it. And it's exhausting. So look for that person, look for that spark. And if you don't have that spark, go back to your communities, right? Like I just said, and I'm going to attach the ANAD groups. I'm going to make sure the link goes out there, but go to those free groups, get some free mentorship, take it, and find those people, right? Find the grandma, okay? Think of my grandma if you're ever thinking, if you got that person, the love of your life in your life, let them step up for you and help you.
Another big one for me is just education. I really truly believe that education is power. And when you are trying to come into a system, especially a medical system, no matter if you're seeing therapy, MD, NP, PA, RD, it doesn't matter. It can feel really scary and daunting to not understand the language or know to how to use your words to explain what's wrong, what's going on, what you feel like you might need, what you're not sure you need. And so for me, I think education and making things easily digestible, even when there are topics that people are told, well, you can't understand. Yes, you can understand. You can. We can teach and we can break things down and we can explain, and really helping people feel confident when they are having conversations, because they can use the language and advocate for what they need based on that.
I just shared the link to the support groups that Mac was talking about. Thank you, Mac, for sending that to me. It's in the chat for you guys. Does anyone else have any other thoughts on how to empower individuals to advocate for themselves during treatment or during the process?
Definitely. I think one thing I definitely stress to my clients is having that level of self-compassion. I think they all been told so many times that, and even here in 2024, as a person of color, we're told that our bodies are wrong. We're undeserving to take up space. We're seeing it in our political system right now. Like, we are not deserving of having these things. So when you start to hear that all the time, you start to believe like, well, maybe I'm not. What's the point? If nobody's going to hear me, if nobody's going to take care of me, what's the point? And so it's important that even if it feels like the world is not giving us compassion, that compassion to ourselves is really important. So encourage yourself and say like, yeah, I know something is wrong, something's not right, and I need answers. Kind of like what Max said, call until somebody figures it out, because somebody will figure it out. It might take a lot of phone calls, it might take a lot of conflict, which we can recognize is very uncomfortable. It's even uncomfortable for me sometimes. It's like that conflict of, I have to go in there and advocate for myself. Why? I shouldn't even have to do that, but I have to. And that's unfortunate that that's how our system is made up. But it's important that if nobody else is going to have me, I got to have me. And I'm deserving to take up space. I'm deserving to ask these questions. I'm deserving to get more answers when I don't know what's going on. So ask, show yourself compassion, and try to be more comfortable with conflict if it does come up.
I just had to jump on that and say, yes, 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 yes. You have to learn to be comfortable with conflict. And as someone who like avoids it, like I'm like, oh, is that conflict? Let me look away. I've learned that I'm like, that's part of the growth. Even for me as an individual, forget the eating disorder, forget the treatment, the care, that's part of the growth. And then I can learn to advocate for others. I can learn to advocate for my own loved ones and for my families and for my systems. But when it gets really, really tough, let me touch this community. I personally, I identify as African American, and I really go to BEAM, which is the Black Emotional and Mental Health Collective. They provide specific resources for Black and African American individuals to talk about these things, to have affirmations when you do go advocate for yourself. You can do this, okay? You're not alone. All these pieces. I just want to say yes, like yes to conflict. Yes.
Did that Beam chat go through to everyone or just to me? I can't tell.
I think
Does
everyone.
anyone else see that in there? Yeah, okay. Just making sure. Thank you, Mac. Okay. We can move on to the next question. What strategies do you recommend for self-care and coping with societal pressures or discrimination related to race or ethnicity?
I struggle with this question a little bit because I think inherently it's asking, how do we care for ourselves when the world really puts harm to us, and then the onus to heal that harm is again on us. So I always sort of go back to, there's nobody like your community. There's nobody who really can empathize with you with open arms like your community. And I think for me, I struggled with that because there was a big part of me that really rejected my own Korean culture for some time. But I realize, as with all the recent happenings in society and sort of the violence against sort of Asian women in general, I think there is so much power in community. And so I think self-care and coping with any sort of societal pressure and discrimination is that you have to stick with your community, and that is in and of itself power, and that you can't do it alone. I think the question is hard in and of itself a little bit, the more I think about it, because I'm not sure if I can figure it out myself. Like, this is I'm not quite sure if I have the perfect answer for that. I'm just gonna stop there because I don't think there's an easy answer for it.
Grace, I think it's wonderful that you're, sharing how you feel about the question though, because it's a difficult one, and that honesty I think is really appreciated.
Yeah, same as Grace. When hearing the question, I'm like, how do you cope with oppression? It's like, because when I hear coping, it's like I'm coping to be more stabilized, I'm coping to be more okay. And that's something that's I cannot be okay with. But I guess in terms of what I have control over, or for at least keeping myself regulated, I'm actually at a loss of words too now that I think about it. Yeah, it's really one of those things that's hard to really answer. And I guess to go back to what Grace said, having a community, or if support is really important to talk about these things openly. Um, like-minded people who also having those same struggles. And connecting in that way, just to at least not feel isolated and alone, like this is, because it is a hard thing to cope with. It's hard to ask somebody to cope with, you know, being oppressed for being a person of color, being oppressed for being a fat person, being oppressed to be a queer person. Like, it's really hard to ask somebody to cope with that. But I guess what it can go back to is like, how do we use that community to at least move forward, to have these conversations, and to problem solve, if that means doing community work, things that sort. Yeah, I think community, like Grace said, could be very helpful. But if somebody else have any good ideas, that would be awesome. Help me out too, so I can help my clients out with this. Because we'll sit in the session like, I don't know, because it's hard.
And, I know I'm not technically a panelist, but for me, I just think that the validation is so important and it really does help. So for those of you that are in the room with someone and this is coming up, but like, that validation is it could be a method of self-care for them, right? Just like, this is what I'm going through, other people go through this as well. And it doesn't mean it's okay, but knowing that you're not alone, I think can really help too.
Yeah, it's wild what you all are saying. It's like, what is the answer? Someone give me the answer real quick. I'd love to have that answer. Every time I go back into like an instance of like, even for my own patients who have faced racism and homophobia, and we'll talk about our experiences together, I'll go back to the part of like, this wasn't your fault. Because I grew up thinking that like, oh, this is part of it, right? Like, this is part of being in this society. This is part of being in America, right? Like, of like, oh, okay, racism, oh, homophobia, that's a thing, So letting people know it's not their fault and they didn't cause that. I think that's the biggest piece.
I think that goes back to that self-compassion too, Mac, like, I am deserving to be in these spaces. I am deserving of these things. Even though society has told me I am not, I am recognizing I am. And so that self-compassion is a big key too, of probably trying to practice some more coping skills, being open, even knowing that you are deserving to have coping skills. I think some people feel like, oh, I'm not deserving of rest. I'm not deserving of taking care of myself. So just even that next step of saying like, you deserve to have these things. You deserve to get rest. It's not a reward. These are things that are as a basic need. So taking care of yourself is important, and you doesn't have to be rewarded.
Have you ever read the book? I'm gonna have to attach it for you because I feel like you've read, I don't know if you have, but there's a book called Rest is Resistance, and it's something it's one I just, yep, you're nodding your head. Okay, you already know what I'm talking about. So the premise of it is that like, we get to self-care, we get to take back, and it's basically like a big, I don't know how else to say this, but it's like a F you to society. You know what I mean? To say, we're okay, we're here, we deserve this. I sometimes treat, like, I talk to my patients about this, I sometimes treat my recovery like that. Like some days, yeah, I'm motivated. I'm like, yeah, I want to do this. And some days I'm like, the system is jacked. I'm going to keep doing this. Because if I fall back, like I'm proving to the system that I'm not allowed to be in this. I'm not allowed to be happy. So rest is resistance. It absolutely is. I'm happy you said that, Tassie.
This was a tough question, but some great thoughts on it. Does anyone have any other thoughts, or anyone have any questions for our panelists around that? I'm going to move on to some extra credit. I mean, we could call it extra credit, extra questions that we have kind of for fun here. And again, if anybody has any questions, please feel free to drop them in the chat or raise your hand, or even just if you want to join the conversation. We've got a small group, so I think that's totally fine too. How do you cater your client's meal plan based on their cultural background and incorporate food specific to their background? I know, Zaina, you had talked a bit about this as well. So yeah, any thoughts on that?
I'm happy to expand a little bit more if that would be helpful. I think I'm the only dietitian on the screen, so I do a lot with the food piece. So I do. I try really hard to learn about all different foods, all different cooking methods, so that when I'm meeting people, I have really good background. I'm never going to know everything. So I ask questions, and I try my best. I'm a human, and so sometimes you make assumptions. So I try really hard not to, and to ask first and lead with that question versus when I see someone assuming they eat X, Y, and Z, or that they know X, Y, and Z. So I go that extra step deeper to have the background and then ask. And from there, we make some small changes, because sometimes I've worked with some individuals who have just immigrated over to the US and are struggling with the development of an eating disorder. And there is a lot of family pressure to assimilate into our culture, to eat the way America eats, to do the things America does. And so they really want to leave behind what they used to do. And it's not for me to judge either way. I need to honor what they want to do and move forward. And on other times, it's the opposite. It's figuring out, well, at home, culturally, our largest meal is lunch, but I'm at school if it's a child during lunch. So we come home and we have dinner at 3 or 4, whenever school ends. And then what does dinner look like? Our traditional. So really working and finding out what's happening and how I can help bridge those gaps. And also on my part, I try really, really hard to be an active team member. I'm not the only provider. And if I am, I'm going to find them a group of providers so that I can communicate these things effectively to their physician, their NP, their therapist, everybody on board, care coordinators, you name it, so that we have an understanding, so that what I have discussed or given plans for isn't undone. Because there's also the added piece of certain misconceptions that typical American society has on different foods, and thinking that they're bad, thinking if you have co-occurring conditions, diabetes, heart disease, etc., you can't eat these. And really helping people find that that's not true. There are certain exceptions where, say that you have a nut allergy, you can't eat nuts. If you have a nut allergy, you could die. And so no, you can't have those. But for a lot of other things, when a patient or individual hears that, say for example, they hear that white rice is bad, well, that feels not only like a dig culturally, but now what do I do? What do I eat? What can I afford? How do I feed my family? And so it's really helping to understand, no, white rice isn't bad. Let's talk about this. Let's educate and then move forward. So I don't know if I over answered or what, but that's what I typically tried.
That was great. Thank you so much. Does anyone else have anything to add? I know that, Xana, you're the only dietitian here, but sometimes things cross over a bit. So we can move on to the next question. Can you recommend any culturally relevant reading materials, blogs, or podcasts, etc.? I know we've talked about some of them. Does anyone else have anything else that could be helpful? The white rice is a staple. I agree.
I actually have a list of readings and some that I have not got the opportunity to read yet. I'm trying to practice my reading this year, y'all. I'm trying to get better. I'm a little slow at it lately, but yes, some readings that I definitely recommend is like The Body Is Not Apology by Sonia Renee Taylor. I've used this book a lot with clients, just talking about like our body is our home, is what we have in this life, and we should not apologize. We should not feel bad about it. So just learning radical acceptance of our body. And then I haven't read it yet, but I heard a little bit about it, is Decolonizing Wellness, I believe. I forgot who that author is. I should have wrote it down, but that's something I definitely would recommend. Just talking about some of what we've been discussing today is just like, we are deserving of access of care, that systems in place have kept us from having these things. And so we have to realize that it's just not like a white person thing, not us realizing, but working on knowing that this is just not like a white person's thing. This is for us to have as well. So yeah, those are two readings I would definitely recommend.
You took my recommendation. No, I'm just kidding. Those are great recommendations. I don't have any books to recommend, but I do have, since I know providers are going to be watching this, go attend the BIPOC Eating Disorder Conference this year for 2024. They had their first annual last year for 2023. So many great topics. It's also recorded and you have access to it till the end of the year, like ongoing materials. One of the best, one of my favorite, I'm biased here, but one of my favorite ones of BIPOC 2023 was The Black Home. And they had this discussion of what it looked like to live in a home that was surrounded in Blackness, and what it looked like for the parents to experience intergenerational trauma and racism, and how it goes down to the kiddos and how it goes down to the grandkiddos and all of that. So if you have not, I would definitely go check out the BIPOC Eating Disorder Conference of 2024.
I quickly dropped a couple things in the chat too. The website is a link to sort of the main directory for at least Asian mental health providers. And then the second book is just a recommendation that I really, really enjoyed, Freeing the Black Body, The Racial Origins of Fat Phobia, that I think was really insightful. And I personally think providers in this sphere should definitely read it. So highly recommend that.
Anyone else have any other recommendations? Oh, we have a question. Yay. What do you think a multicultural recovery space would look like? Do you think BIPOC needs separate spaces for recovery and healing? I've also seen other groups that function as LGBTQ plus and BIPOC spaces simultaneously. Any thoughts? That's a great question. Thank you.
I will say that Rock Recovery is currently in the and Izzy, please correct me if I'm wrong. I know we are currently creating a Bridge to Life group, so a body image group specifically for BIPOC communities. So when that gets started, please go on our website so you can see if you would like to join. So in terms of just like the initial question, I think it is important that we do have those groups and services specifically for BIPOC communities. Just like you said, there are groups that are specifically tailored for like binge eating. There's some that's specifically tailored to, anorexia, bulimia. And I think it's okay to say that some should be tailored specifically for BIPOC communities so that they can have that space to share, to talk about the experience of being a person of color, especially in America. And it feels like it's a safe space to really share those experiences. So yeah, I think, yes, it's important that we have that opportunity for BIPOC communities. And again, check our website. We will have that group started in the near future. I think I saw summer, fall, something like that. Yeah. Sorry, spring, summer.
Does anyone else have any other thoughts around that? And Izzy just dropped a rock recovery link for that.
I think I also agree that really place where BIPOC folks can gather separate from, I think, the grand collective really serves mainly for, I think, in my opinion, as safety. There are certain things I think folks who have BIPOC identities and backgrounds feel more afraid to share with folks who may not understand. And so I think I do agree with that there is an importance to carving that little space out for us, not a little, it should be a large space for us. And I think, yeah, I think that's the answer. I think absolutely there should be a space for us. I sometimes do struggle, well, why are we then creating a BIPOC space that's other than the greater collective? And I don't necessarily see it that way. I think, especially in eating disorder care, there needs to be a place where we feel safe and that we can sort of feel like our presence is not only welcomed, but honored and celebrated. And I think this BIPOC space is exactly what that can provide.
We can definitely take on any open questions for those of you that are on with us. Feel free to raise your hand. We can unmute you if you'd like to share, or you can message me directly if you'd prefer to be anonymous. It's been a great discussion.
While we're waiting for questions, yeah, Grace, we deserve a big ol' space.